You took your blood pressure pill today the same way you always do. A sip of water, a few seconds. Then you moved on with your morning and probably gave it no further thought. Most people don't. And yet, if you are over 60 and that pill is amlodipine, losartan, or lisinopril, there is something I need to tell you that many patients never hear clearly enough when that prescription is first handed to them. Because sometimes the problem is not the medicine itself. Sometimes the problem is what begins happening afterward, quietly, slowly, in ways that are easy to dismiss. A cough that seems harmless, ankles that look different by dinner time, weakness you blame on a poor night's sleep, dizziness you call old age, a blood pressure reading that scares you into making the wrong decision at the wrong moment. A few years ago, I got a call from a woman named Margaret about her husband, Thomas. He was 77, former high school baseball coach, punctual, proud, and the kind of man who kept every appointment card in a neat row on the refrigerator. He had been taking amlodipine exactly as prescribed, never careless, never reckless. But over time, his shoes started feeling tighter in the evening. His socks began leaving deep marks around his lower legs. He said nothing. He stopped joining his friends for breakfast because he did not want anyone noticing the swelling. Then he began skipping doses on days when he knew he would be out of the house, convinced the medication was making his heart worse. It wasn't. But his silence nearly created a much bigger problem than the swelling ever did. I'm Dr. Michael Hardee, and after decades of caring for adults with heart and blood pressure problems, I can tell you this with complete honesty. Many seniors are taking these medications correctly, but they still do not fully understand what to watch for once they start them. That is not because they are inattentive. It is not because their doctors do not care. It is because a lot of important information gets compressed into a very short appointment, and the body does not always respond in simple, obvious ways. So today I want to walk you through 9 warning signs and patterns every senior taking amlodipine, losartan, or lisinopril needs to know. Some are uncomfortable, some are subtle. One of them requires immediate emergency attention. And the last point may be the one that changes the way you think about your blood pressure medication from this day forward. Before we go any farther, if you have ever started a medication and later wondered whether what you were feeling was a side effect or just part of getting older, you are exactly who this message is for. Here is where so many people begin with the wrong assumption. They hear that all 3 medicines are for blood pressure, so they assume they are basically interchangeable. They are not. They may share a goal, but they do not work the same way, and that means the body can respond to them very differently. Amlodipine belongs to a group called calcium channel blockers. The simplest way to understand that is this. Your blood vessels have muscular walls, and those muscles tighten and relax based in part on calcium moving into the cells. Amlodipine reduces that entry. When less calcium gets in, the vessel wall relaxes more easily, and pressure inside the system comes down. It is effective, often very effective, but it can also change the way fluid behaves in the lower part of the body. Lisinopril works differently. It blocks an enzyme involved in producing angiotensin II, a substance that narrows blood vessels and encourages the body to hang on to fluid. Interrupt that process and pressure often improves. That is one reason lisinopril is commonly used in people who also have diabetes or certain kidney concerns. But because it changes that chemical pathway, it can create very specific side effects that a patient may never connect back to the pill. Losartan works on that same overall system, but at a different step. Instead of preventing the signal from forming, it blocks the body from responding to it properly. The result can still be lower pressure, but the side effect profile is not identical. That distinction matters more than most people realize, because if you misunderstand which medicine you are on and what it commonly causes, you may misread your own symptoms and react in a way that puts you at greater risk. The first warning sign is swelling in the feet, ankles, or lower legs, especially if you take amlodipine. This is one of the most common reasons people grow frustrated with the medication, and it can be deeply upsetting when nobody has explained it in advance. Many seniors look down in the evening, see puffiness around the ankles, and immediately fear heart failure, kidney failure, or circulation collapse. Sometimes it is something more serious and should be checked. But with amlodipine, there is a very common explanation that has nothing to do with your heart suddenly giving out. Amlodipine can relax the small arteries more than the small veins. That means blood can move down into the legs more easily than it moves back out. Fluid then shifts into the surrounding tissue. The pattern matters. Shoes fit better in the morning, tighter in the evening. Socks leave marks. The swelling may improve overnight and return later in the day. That is often the clue. The danger is not only the swelling. The danger is what people do because of it. They cut pills in half without asking. They skip days before church, dinner, or family gatherings. They quietly decide the medicine is wrong for them and stop taking it. That can send blood pressure climbing again while the real issue remains untreated. If your ankles swell after starting amlodipine, that deserves a conversation, not a silent experiment. The second warning sign is dizziness when standing up, especially in the first days after starting medication, after a dosage increase, or during periods of dehydration. I want you to notice something important here. A medicine can be helping your blood pressure and still make you feel temporarily unsteady under the wrong conditions. Those are not opposites. Both can be true. I once saw a woman named Jean, 72, who said she felt wobbly every morning when she got out of bed. She had started telling herself she was getting frail. In reality, her blood pressure was dropping too much when she stood up too quickly after taking medication on an empty stomach. That difference matters because one story leads to fear and resignation, while the other leads to adjustment and prevention. If you feel lightheaded when rising from a chair, getting out of bed, or standing in the shower, do not brush it off. Dizziness can mean your body needs reassessment, not self-blame. The third warning sign is a dry, nagging cough if you take Lisinopril. Not congestion, not mucus, not a chest cold, not the kind of cough that clears after a few throat lozenges. I mean a persistent, irritating, tickling cough that keeps coming back and often seems worse at night. One of the reasons this causes so much confusion is that it may not begin right away. It can appear weeks or even months after the medication was started. By then, many patients never suspect the prescription. They change detergent. They blame pollen. They buy humidifiers. They stop using the ceiling fan. They wonder if it's acid reflux. Meanwhile, the actual explanation may be sitting in their pill box. A man named Richard came to see me after months of poor sleep. He was tired, frustrated, and convinced something in his home had become an irritant. When we went back through the timeline slowly, the cough had started not long after Lisinopril was added, but enough time had passed that he never made the connection. He thought side effects were something that happened right away or not at all. That assumption cost him months of discomfort. A dry cough from Lisinopril is not usually life-threatening, but it is absolutely worth reporting because there are other options. The fourth warning sign is one nobody should wait on: swelling of the lips, tongue, face, or throat, especially if swallowing or breathing becomes difficult. This is not in the category of mention it next month. This is emergency care. Rarely, medicines like Lisinopril can trigger a serious reaction called angioedema. It does not happen to most people, but when it does happen, speed matters. I want to be crystal clear. Dry cough, call your doctor. Swelling that affects the mouth, tongue, or breathing, get immediate help. The fifth warning sign is muscle weakness, unusual cramping, or an irregular heartbeat, particularly in people taking Losartan or Lisinopril. And this is where the conversation moves out of the medicine bottle and into the kitchen. Because one of the most overlooked dangers for seniors on these medications is not always a prescription interaction. Sometimes it is a healthy product used with the best intentions. Many people are told to reduce sodium, which is sensible, so they buy salt substitutes. They start using electrolyte powders. They pick up meal replacement drinks marketed as heart-friendly. The problem is that many of these products contain potassium, sometimes a great deal of it. Losartan and Lisinopril can raise potassium levels in the body. Add extra potassium on top of that, and in some people, the number can climb too high. When that happens, the heart's electrical system may be affected. What makes this risky is how quiet it can be. Some people feel weak, some cramp more than usual, some notice palpitations, some feel almost nothing at all until the level is found on blood work. I remember a patient named Harold who proudly told me he had stopped salting his food and switched to a better-for-your-heart substitute. He truly believed he was helping himself. He was also on Losartan, and his potassium had drifted into a dangerous range. He was not being careless. He was trying to do the right thing with incomplete information. If you take one of these medicines, read labels. Heart healthy and safe with my prescription are not automatically the same thing. The sixth warning sign is a problem hiding in the bathroom cabinet rather than the kitchen. If you are taking Losartan or Lisinopril, and especially if you also take a diuretic or water pill, regular use of ibuprofen, naproxen, or similar anti-inflammatory pain relievers can increase stress on the kidneys. This is one of those areas where trouble develops because the products feel ordinary. They came from a store shelf, so people do not always think of them as part of their medication list. But the kidneys care very much. Under the right conditions, especially if you are a little dehydrated, that combination can reduce blood flow through the kidneys and create a situation they do not handle well. I have seen thoughtful, organized patients who would never miss a prescription still end up with kidney trouble because nobody had ever clearly told them to mention the over-the-counter pain reliever they were using for arthritis. If you need those medicines frequently, that is not a detail to keep to yourself. The seventh warning sign shows up when you get sick: vomiting, diarrhea, fever with poor fluid intake, heavy sweating in hot weather, a stomach bug that leaves you unable to drink enough. This is when a medication that was perfectly appropriate 2 days ago can behave very differently today. Not because it became bad, but because the environment inside your body changed. These blood pressure medications assume a certain fluid balance. If that balance collapses, the same dose may now push pressure too low or contribute to kidney stress. Seniors get into trouble here because they are often extremely disciplined. They think, "I never miss this pill, so I should take it no matter what." But illness changes the rules. I remember an older gentleman named Calvin who had been meticulous with his medicine for over a year. Then he got a stomach virus, could barely keep water down, and still took his usual dose that morning because he believed consistency was always the safest path. Later that day, he stood up and nearly fainted. He had done exactly what he thought a responsible patient should do. The issue was not responsibility. The issue was context. When you cannot keep fluids down, that deserves medical guidance before you simply power through your usual routine. The eighth warning sign is not a symptom in your body. It is a mistake in how you interpret your blood pressure readings. And this one causes enormous anxiety. People measure while upset, right after climbing stairs, right after an argument, immediately after a scary thought, or over and over again every time they feel unsettled. Then they stare at a single number as though it is a verdict on whether the medication has failed. It is not. Blood pressure moves. It changes with posture, stress, pain, sleep, caffeine, timing, and technique. One isolated number, especially taken in agitation, can be noisy and misleading. I once sat with a woman whose notebook was filled with readings taken whenever she felt nervous. She was certain her medication no longer worked because the page looked chaotic. But when we simplified everything, same time of day, seated position, feet on the floor, arms supported, 5 minutes of rest first, the pattern was far calmer than the fear in her mind had suggested. This matters because fear drives bad decisions. A single high reading leads someone to double a dose. A single low reading leads someone to skip tomorrow's pill. Good treatment decisions are based on patterns, not panic. If you are going to measure, measure consistently. Otherwise, the number may create more confusion than insight. The ninth warning sign is the one I most want every senior and every adult child listening to remember, and it is this: Feeling fine does not always mean the situation is stable, and feeling off does not always mean the medication is wrong. Blood pressure medicine works inside a larger environment. Salt intake, sleep quality, hydration, weight, kidney function, other medicines, heat, stress, and activity level all shape what that pill is able to do on any given day. This is why two people can take the same dose of the same medicine and have very different outcomes. One sleeps poorly, eats heavily processed food, rarely drinks water, and takes ibuprofen several days a week. The other walks regularly, keeps a steady routine, and notices symptoms early. Same prescription, different internal conditions, different result. There is a hard truth here that many people never hear plainly enough. These medications help control high blood pressure, but they do not erase the deeper biology, wear and tear, and daily habits that helped create it. Amlodipine can relax blood vessels, but it does not undo decades of arterial stiffness by itself. Lisinopril can change a chemical pathway, but it does not make follow-up unnecessary. Losartan can block part of the signal, but it does not give you permission to stop paying attention to the rest of the system. That is why understanding matters so much. Because the safest patients are not always the ones with the most perfect-looking pill organizer. Often they are the ones who know what deserves a phone call, what requires urgent action, what can wait for routine follow-up, and what should never be handled by guessing. So let me bring this together in a way you can actually use. If you take amlodipine, pay attention to swelling in the ankles or feet, especially if it gets worse later in the day. Notice flushing, pounding sensations, or dizziness when standing. Do not silently skip tablets because of embarrassment or worry. Report what you are seeing. If you take lisinopril, watch for a dry cough that will not leave, even if it starts long after the prescription began. But if there is swelling of the lips, tongue, throat, or trouble breathing, that is not a wait-and-see situation. Get emergency care. If you take losartan or lisinopril, be careful with potassium. Read labels on salt substitutes, electrolyte products, and nutrition drinks. If you notice weakness, unusual cramps, or a strange heartbeat, do not ignore it. Ask when your potassium and kidney function were last checked. If you take any of these medications, be honest about over-the-counter pain relievers. Be cautious when you are sick and losing fluids. Do not assume the same dose behaves the same way when your body is depleted. And do not react to one random blood pressure number as if it tells the whole story. Most importantly, never stop these medicines suddenly or change the way you take them without medical guidance. The body does not always forgive abrupt decisions made in fear. Let me tell you what happened with Thomas. Once we explained why the swelling was happening, reviewed his medication plan, and addressed the issue directly instead of letting him hide it, everything changed. His blood pressure came under better control because he stopped skipping doses. The swelling improved with proper adjustments and follow-up. But what stayed with me most was not the medical part. It was what he said when he came back. He looked at me and said, "I spent weeks thinking something terrible was happening, and the whole time I was more afraid of sounding foolish than of asking the question." That sentence has stayed with me because it describes far more patients than most people realize. Not the exact swelling, not the exact medication, but the exact silence. The cough they keep tolerating, the weakness they keep dismissing, the dizzy spell they blame on age, the supplement they never mention, the salt substitute they assumed was harmless, the skipped dose nobody knows about, the single scary blood pressure number that sends them into a spiral. This is why education is not extra, it is part of treatment. A prescription without understanding can leave a person compliant on paper and confused in real life. And confused patients do what human beings always do when they are afraid. They guess, they delay, they hide symptoms, or they try to solve it quietly on their own. I do not want that for you. I want you to know what your medication is likely doing. I want you to know which reactions are common, which are important, and which are urgent. I want you to understand that being careful does not mean being silent. In fact, the most careful patients I know are usually the ones who speak up early. And if you are listening to this for a parent, a spouse, a brother, a sister, or a friend, please understand something. Sometimes the senior in your life is not ignoring symptoms because they do not care. Sometimes they are ignoring them because they do not want to be a burden, do not want to sound dramatic, or honestly believe they are supposed to endure it. One clear conversation can change that. So before you take your next blood pressure pill, ask yourself one simple question. If my body starts sending me signals, would I recognize which ones matter? That question alone can prevent months of confusion. I'm Dr. Michael Hardee, and if you are taking Amlodipine, Losartan, or Lisinopril, I want you to remember this. The medicine is only part of the plan. The other part is understanding what your body may be trying to tell you while you are on it. The people who do best over time are not always the people on the strongest prescriptions. Very often, they are the ones who notice early, ask questions, and refuse to confuse silence with strength. And if nobody has ever sat down and explained these warning signs clearly to you before today, that is not your failure. But now that you know them, you are in a much better position to protect yourself.